This module will provide an overview of speech and language impairments, or speech and language disorders. In this presentation, you will learn about the definitions of speech and language impairments, prevalence, causes, characteristics of students with speech and language impairments, and effective teaching practices for working with students with speech and language impairments or disorders. The term speech and language disorders reflects a wide range of conditions associated with impairments in speech and language. Other terms used include communication disorders and speech or language impairment, or SLI, which is the definition under IDEA. SLI, or speech language impairment, is defined as a communication disorder such as stuttering, impaired articulation, language impairment, or a voice impairment that adversely affects a child's educational performance. You will learn about all of these different impairments and disorders throughout the presentation. There are a variety of ways to define communication, including communication is a basic human need, is an exchange of information and knowledge among people. Communication requires a message, a sender, a receiver, and a channel or a route through which the message travels. It involves reciprocity or back and forth exchanges, and communication can be verbal or nonverbal, including eye contact, body language, facial expressions, and gestures. Language is a different term from communication. Language is a system of symbols governed by complex rules that people use to communicate. Language is based on culture, and there are more than 6,800 languages, including American Sign Language, or ASL. There are two forms of language, expressive language and receptive language. Expressive language entails producing language, and receptive language refers to the ability to understand language. There are 5 components of language in which students might have difficulties. It's important for teachers to understand these 5 components of language and address these areas of need within their lessons. The first component is phonology. Phonology is the ability to hear sounds used in a language and use them correctly in words. Morphology is the next component of language, and this involves the ability to form words using one or more morphemes. Morphemes are the smallest units of language that have meaning. Syntax are the rules that determine the order in which words are used. Semantics is the meaning of words that are put together to form thoughts and sentences. And pragmatics is the social use of language, understanding and using nonverbal language, social rules of using language, etc. So if we put this all together, students have to be able to hear the sounds used in language and manipulate those sounds to correctly form words and to be able to hear words. They need to be able to understand the smallest units of language that have meaning, such as prefixes and suffixes that add meaning to words. They need to know how to use words in the correct order to form sentences that make sense to other people and to understand sentences that are said to them or sentences that they read. They also need to be able to understand the meaning of words that are used in sentences and thoughts, and that has to do with understanding vocabulary. And then finally, being able to understand how language is used during communication with other people to appropriately engage in the social behaviors necessary to effectively communicate. Students who receive services under speech and language impairments could have difficulties in communication or language, like we just discussed for the previous slides, or they might have difficulties in speech, or they might have both. Speech is the use of the oral channel for exchanging information and knowledge. And there are 4 elements of speech that students may have difficulties or impairments with. The first element is voice. Voice means things such as pitch, or the highness or lowness of the sound, intensity, the volume, and the quality, which could be smooth or hoarse. Resonance is the second element of speech, which involves the nasal aspect of spoken sound, meaning the balance of sound vibration in the mouth, nose, and throat. Articulation is the third element of speech, and this involves the movement of the tongue, teeth, lips, and palate to produce the sounds of language. And this is the area that is often addressed through speech therapy in schools to help students produce words and sentences that others can understand. And finally, the fourth element of speech is fluency, and that's the ability to speak without hesitations that interfere with clear communication. There are a variety of different speech and language disorders that you can learn about, and there is a link provided here that gives an overview of various speech and language disorders such as apraxia, stuttering, a selective mutism, and other disorders. So feel free to go to this link to learn more about those things. Approximately 1.7% of school-age children receive services for a speech or language disorder as their primary area of disability. However, there are many more students who receive speech and language services in addition to receiving services for a different primary disability, such as a learning disability, an autism spectrum disorder, an intellectual disability, or emotional and behavior disorder. As is common with most other disabilities, boys are approximately 2 times more likely than girls to be identified with speech or language disorders. As far as causes go, causes for speech and language impairments can be biological or environmental. Biological causes could be due to problems related to the central nervous system, muscle weakness, brain injury, heredity, or congenital, meaning it was present at birth. Environmental causes could be related to repeated ear infections, neglect or abuse, allergies, poverty, and malnourishment. As far as academic characteristics of students with speech and language impairments goes, these students are at high risk for reading difficulties. These students may have difficulty sounding out words, adding prefixes or suffixes, recognizing compound words, reading comprehension, and understanding figurative language. Of course, these difficulties are all related to impairments in the 5 components of language that were previously discussed. For students who have receptive language impairments, they may have difficulty comprehending and following directions given to the class. There are some social and emotional characteristics that students with speech and language impairments may also deal with. These students might be teased by their peers, or their peers may not understand them. These students might have impairments in pragmatics and not be equipped with the social skills required to be successful communicating with peers. And these students may not be able to fully participate in conversations with peers if they cannot find the words they need to use in order to have these conversations. Students with speech language and impairments may also have some behavioral characteristics. These students who cannot effectively communicate may engage in challenging behaviors due to frustration with the inability to let their wants and needs be known. There are a variety of effective practices for teaching students with speech and language impairments. First is the need for early intervention, meaning research has shown repeatedly that when students receive early speech and language intervention from birth through age 3, and up through age 5, they typically are able to perform better academically and socially and communication-wise when they are older. The use of assistive technology and augmentative and alternative communication is very important for students who have limited verbal abilities or who are nonverbal. We need to use evidence-based literacy instruction to provide quality interventions for improving decoding skills, phonemic awareness, vocabulary understanding, and reading comprehension. Students with SLI will benefit from specific social skills instruction taught through systematic instruction, the use of positive behavioral interventions and supports to address any behavioral difficulties that they are experiencing. These students definitely need an increased use of visual supports to help them understand concepts that they do not understand through receptive language channels. And when teaching new concepts and vocabulary rules and vocabulary and rules and new skills, it's important to use that systematic instruction that is explained in another module. Some students with speech language impairments will need increased processing time, meaning they have auditory processing deficits. So when they're asked a question, they need some time to process it before giving an answer. So it's important for teachers to recognize that and provide that wait time. In some cases, teachers may need to slow down their rate of speech to support the student's comprehension of what's being said. It's also important to use clear, concise language when giving instruction. Do not provide sentences and directions that include so much fluffy language that the meaning behind the directions gets lost. And of course, it's important to collaborate with families as well as speech and language therapists to make sure that interventions are being designed using evidence-based practices and that they're being implemented across a variety of settings.